So I'm specializing mostly in patients with inflammatory bowel disease, and I realized that early on in my career, which was just 3 years ago, that many of my IBD patients have severe C. diff, recurrent C. diff, and the currently available antimicrobial therapy doesn't necessarily cure a large portion of them. And my colleagues at other institutions were already doing fecal microbiota transplantation, so I thought that I needed to establish a program at our University of Indiana. We published a paper recently as a multi-center group led by Colleen Kelly, evaluating the efficacy and safety of fecal microbiota transplantation in the immunocompromised population, and we found that it was actually quite successful, and no significant adverse reactions were observed. So I was really encouraged by these data, so I continued to offer fecal microbiota transplants for my IBD patients who were immunosuppressed. And the current presentation, the ACG, in our case series of 41 patients collected from a total of 6 academic centers. 63% of patients were immunocompromised. So in my patient population, I had 3 patients who were aged under 18. Specifically, they were aged 3, 8, and 12. They did not have underlying IBD, but sadly, they had recurrent Clostridium difficile episodes more than 5 times. They did extremely well with the fecal transplant, and to date, which all of the kids are at least 1 year out of the procedure, had no adverse reactions, and I do not anticipate that on the long run they will have further adverse events. So specifically, we had low data previous to this study about the efficacy and safety of fecal transplant in the IBD population, also had recurrent C. diff. And what we found was that the overall efficacy was 88%, but several patients needed 2 or 3 procedures to achieve this high cure rate. With a single fecal microbiota transplantation, the cure rate was 71%, which is significantly lower than patients who do not have the diagnosis of inflammatory bowel disease. So the conclusion from our study is that yes, fecal transplant is a highly successful procedure in the treatment of recurrent Clostridium difficile infection in patients with inflammatory bowel disease. However, in order to achieve a 90% or higher cure rate, most likely need to administer 2 or potentially 3 fecal transplants.